Hello, everybody, and welcome to another community
First of all, Mayor,
conversation
thank you very much for giving me the
on
opportunity.
Facebook Live. It's Friday at noon.
Just one portion of the
Economic impact.
serve the many, many people.
Thank you, Mayor, and thanks for this opportunity.
Hello, everybody, and welcome to another edition of Community Conversations right here on Facebook Live. I'm Mayor Eric Pappenfuss. It's good to be with you all. And today's topic is getting to that light at the end of the tunnel. We're going to talk about vaccine distribution in Harrisburg and Dauphin County. And we're going to talk about how we all collectively begin to move on with our lives as we get past the health emergency. I do, however, want to start by putting this in context and saying we're not through the woods yet. And we did get some somewhat alarming data this past week regarding our wastewater epidemiology. Moment's going to put up on the screen the latest information that we get from BioBot, which again tests the wastewater of Harrisburg and the surrounding regions for the prevalence of the virus. We're seeing a tick up that mirrors what we saw back in November. It's a significant tick up, and we're going to monitor it very closely. This is one of the reasons that we are testing the water. There could be a number of reasons for it. This is from a sample collection date of April 5th, so it's already a few days old. And we're starting to see that trend. And it could be that people are letting their guards down a bit. And that's why we've got to be careful. We've got to continue to be socially distant, continue to wear a mask, continue to be vigilant so that, and continue to encourage as many people as possible to get vaccinated so we can reach a herd immunity. But in the meantime, the virus is still there. And the data is showing it creeping up again. If you go to the next graph moment, it's even a little more alarming because it shows that in relationship to the hundreds of other municipalities that are also being tested by BioBot, that Harrisburg is our levels are higher than 90% of others and significantly up. If you look at the red line versus that's our sample versus the median national average, which is that gold line there in the middle. We're above 90% of the qualified samples. And the data nets to an estimation of about 130 new cases a day, 130 new cases a day in the Harrisburg metropolitan area in the watershed area of Capital Region Water. So that's a little sobering, but at the same time, we are starting to see life return to the city. I was at a ribbon cutting yesterday. I was speaking to people who were remarking on the fact that traffic is starting to pick up in the city. Who would have thought that traffic would be something that people would miss? But it's coming back. Employers are starting to return to more hybrid and more in-person schedules. And in terms of announcements, the city just announced that we are going to go forward with what will be our 53rd annual Arts Fest. And that is going to begin on May 29th through May 31st, Memorial Day weekend. We're going to do it a little bit differently this year. We are reimagining it as a sort of hybrid online and in-person experience. We're doing it entirely on City Island. And the reason we're doing that and not having it spread out over the entire waterfront is that we can control the entry and exit points. We can have traffic all go in one direction. We can do a better job of in enforcing the social distancing and potentially slightly reducing the number of people or vendors, and having basically designated areas that are carefully monitored. We think this is going to result in a very successful event. You'll still be able to get your have your favorite interaction with our artisans, both in person and online. There'll be food trucks and there'll be other things, and this is and masks, of course, will be required. But this is coming up for Memorial Day weekend, usually the traditional beginning of summer, and it's a sign that we're all moving back to more activity. Also wanted to announce the City Council meeting for this week is an important one. It is coming up on Tuesday, April 13th, and as of now, the City Council is planning to vote on a series of affordable housing bills that we introduced that I think are going to make a very big difference in Harrisburg. As many people know, maybe you've read in this month's Berg or you've seen online, there is hundreds of millions of dollars, almost $1 billion worth of development projects in the city currently in the zoning pipeline. and more to come. And when it comes to housing, we want to make sure that we have affordable housing in every quadrant of the city, every neighborhood. And these incentives really do offer developers a reason to not just do market rate housing. There's a number of different things, from density bonuses to height bonuses to expedited processes, which all of which will make, I think, make it more enticing to have a measure of workforce and affordable housing. But that vote is coming up on April 13th, and people should join in via Zoom. City Council is still virtual. And I've given Moman time to put our latest graph up on the screen, and he's done it. There it is. It is a really interesting graph. This shows, I think, the success of the city's eviction moratorium based on where we were before the moratorium, which really went into effect at the beginning of the year, and where we are now. If you look at the dark line, that's the orders for possession that are being served, and they've really dwindled to nothing since we put our moratorium in place. Stronger than the CDC's guidelines, stronger than anywhere else in Pennsylvania. It basically says that you can't lose your home for any financial reason whatsoever. We have the cooperation of the court system. It's working well. This graph was provided by the Greater Harrisburg Tenants Association, and I wanted to share it with you because it shows you that while their evictions continue to be filed, nothing's being processed, and the orders of possessions aren't being served. That said, we are going to extend the eviction moratorium probably for one more month, and there's sort of three metrics that we're using to determine how long we keep this in place. And we don't do this lightly, and we understand that it is a burden on landlords and others in the city. But the first reason we're going to extend it is because much of the rental relief funding, including a lot of the funding that's gone to the county, is going to be going into effect in the second half of April. It hasn't already hit the streets, and 30 more days seems like it will give people an opportunity to access that relief and have that relief make it into people's pockets. Number two, we've always used vaccine distribution as a metric for how long we would keep the moratorium in place. And now we're starting to see, and that's our topic today, that people who want the vaccine are going to be able to have increasing access to get the vaccine. We have phase 1C opening up here this coming week, and then basically everyone in Pennsylvania being able to access the vaccine by the end of April, and certainly within the next 30 days. So that is another reason to extend the eviction moratorium for a little bit longer. And those, coupled with some of the trends that we're seeing in the BioBot data and other things, indicates to us that that while the end is in sight, we're not there yet. And I think that's really the theme of today's show. But there's a lot of reason for hope and optimism, and there's a lot of positive things that are happening. But we've got to all keep our eye on the ball. So I want to introduce our guests now, and we're going to start with Lou Baverso, who is the COO of UPMC Pinnacle and the president of the Central Region for UPMC. Lou, great to have you on Facebook Live. And I want to specifically talk about the vaccine, because I know that access to the vaccine is on everyone's minds at the moment. So let's start with the view from UPMC and what you all are doing to help meet the community's needs with regard to access to the vaccines.
Great, and thank you, Mr. Mayor. I appreciate being here this afternoon, and certainly excited to talk about access to the vaccine. UPMC currently has 30 community-based locations available to make sure that we are offering the vaccine to the public. We have seen an increase in availability of vaccine, and so as we get it, we are working hard to make sure that we get shots in arms. We've had an amazing opportunity over the last couple of weeks to work within Dauphin County with our commissioner here, with the city, and with Chief Enterline on the drive-in vaccine clinic. And we are proud to say that we have done over 60,000 vaccine doses here in this region, and UPMC across the state, well over 300,000. So again, our goal has been to make vaccine available, to make sure that we're educating on the effects of vaccine and encouraging folks to get vaccine. It really is how we'll continue to see the light at the end of the tunnel, as you said. And while we're not at the end yet, we can see it, and the vaccine is how we're going to get there.
Yeah, that's great. And so you mentioned a number, 60,000, which is for our region where you all are in terms of the vaccine. Where's the number that we're trying to get to? What is the goal in order to reach the herd immunity that people talk about, where we know the vaccine is going to be effective for the population as a whole?
Right. So herd immunity really gets us closer to that 80% mark, right, where we can safely say that 80% of us around us have been vaccinated or greater. For us, we still have a ways to go. And I think, clinics such as what we're doing with our partnership with HAC and the drive-in is going to allow us to get those larger numbers at a quicker pace. But we still think we're looking towards the June timeframe before we get to that point, or at least that's the best prediction we can give today based on what we know. But it changes daily as we get more shots in arms.
Okay. So a couple follow-up questions. So if people are watching this and they'd like to get the vaccine, but they don't really know how to register, how to get access to it, why don't you walk folks through the basic steps about how they can go about and register for the vaccine?
So we've tried to make this as easy as possible. So for those that have access to a computer, there is a website, vaccine.upmc.com, where you can go in and register to say that you want the vaccine. From there, within a few short days, if not, depending again on availability of vaccine, we are reaching back out to you via the communication method that you prefer to schedule you for a clinic. And we're trying to schedule you to a clinic that's the closest to where you live. For those that don't have access to the internet, there's also an 800 number that you can go through the same steps via the 800 number. That's 1-844-876-2822. That number will give you access to the same clinics that you would get if you went through the website. And we're asking folks to only use the number if you don't have access to the internet.
I think early on in the pandemic, when people were trying to register for the vaccine, there were long waits and long times between when the vaccine would be available. And I'm wondering what the time lag is now. So if somebody were to call today, try and register for the vaccine, when could they expect potentially to get an appointment?
So today, if someone called, they're more than likely getting their appointment within 5 days. And again, that number changes only by the number of vaccines that we have available. Next week it could be slightly longer or shorter. And so as we continue to open up the criteria, and as Pennsylvania has opened up the phases, we expect that number to grow slightly in terms of the requests, but we strongly believe that we have the ability to beat that demand.
Okay, that's fantastic news. And we're going to talk a little bit about what's going on up at HAC specifically. But can you talk a little bit about what you all are doing to make the process safe and straightforward and easy? Walk people through what they would expect.
So we've gone through extensive measures to make sure that folks that are safe. And for the purpose of this conversation, I'll focus on the drive-through one because I think that's the one that services this region in the greatest quantity. So folks will drive in through the HAC parking lot. They'll register. They'll make sure that they're on the scheduled list. There are no walk-ins or drive-ins, I should say. And from that point, they'll move forward in the line to where under the tent, they get their vaccine. We grease pen on the windshield, the time of the vaccine, and that's important so that as folks exit the tent and are parking for their 15-minute observation, a lot of attendants that we have, our staff that are walking the lot to make sure no one's having an issue knows roughly when that person can be released. And as you can see on the screen here, this is exactly what it looks like and what a great operation that it is. After that 15-minute expiration, we are also making sure that we schedule your second dose, and then you are released to go ahead and leave and return back to the road on the exit. And we'll see you in the right amount of time for your second dose.
And can you talk a little bit about the supply chain issues? I know we're reading, in the national news about problems with the distribution of the Johnson & Johnson vaccine. Basically, is supply able to keep up with demand, and will it continue to be able to keep up with demand, especially for us in our region?
So I think the State Department of Health has done a nice job of keeping the vaccine flow moving in the right direction. We have seen our numbers increase week over week. And again, as and the ask has been that we use our vaccine within a week. And so we have tried very hard to make sure that we use each and every dose. We have wasted none. We continue to see that number continue to meet the demand. Again, there are logistics to getting folks through the process, but we have worked those out very strongly and feel confident that we can meet the demand as we continue to get that vaccine in. And again, I think the state has done a nice job, responding to that.
Okay, thank you so much, Lou. One final question for us for today. Will you make the case for why people should get the vaccine? I know there's still some hesitancy out there regarding potential side effects, people are out there sometimes really sort of agonizing over this decision. But what would you say to those that are contemplating it but not quite sure if they want to get it?
Sure. So this is a new vaccine, and that often creates some uneasiness. But the reality that we have seen in the time that we've been giving the vaccine and in the science that's behind the vaccine, the side effects are minimal, even for those folks that have a small number that have had a more serious reaction. It has been less of a reaction than getting the virus. This virus spreads quickly and it spreads easily. And so vaccination is how you're going to prevent from getting it. Vaccination will keep you out of the hospital and will keep you from getting extremely sick. And so what we really need to make sure that we tell everybody is the vaccine is better than getting the virus. So get the vaccine. It prevents you from getting it. It helps prevent your family from getting it. We all want to keep our loved ones safe, and this is the way to do it during this time.
Thanks, Lou. And it's not just for seniors, obviously, or people with underlying conditions. It's also for younger folks and folks that are healthy. I saw a statistic this past week which made a difference to me, which it said that if you take away non-seniors and you just look at the younger population, COVID has claimed over 100,000 lives, and not a single person has died because of the vaccine. There hasn't been a single death linked to the vaccine. There are some side effects. You might get a sore arm. You might get some swollen glands. You might feel under the weather for a bit of time, but you're not going to lose your life, and you're going to help get us to that point of herd immunity for the community at large. So, Lou, thanks for your perspective. We're going to go now to Dauphin County Commissioner Mike Prees. Good to have you back, sir. Why don't you set the stage for us, Mike, a little bit about the county's role? We hear a lot about the State Department of Health, and here I am at the city level talking about what we're doing. What role is the county in sort of helping to both deliver the vaccine and help educate people about the pandemic?
First of all, Mayor, I want to say a personal thank you for your leadership during this pandemic and working with officials throughout Dauphin County, specifically us at the County Commissioner's Office. And I want to give a special shout out as well to Chief Enterline and his amazing staff for the great work that they're doing, assisting us at the mass COVID drive-through vaccination site over at Harrisburg Area Community College. Dauphin County's monitored the pandemic very closely. Even before the very first Dauphin County COVID case reported back on March 22nd, 2020, our Department of Public Safety's team worked to ensure that our municipalities, nonprofits, and first responders all had the PPE that they needed. And when it wasn't available from the normal channels, they found suppliers for the county to purchase from and continue distributing to those who were in need. We paid particularly close attention to our long-term care facilities and other congregate facilities to identify all available sources of assistance that they needed that we could not provide. And I think it was good that you said at the beginning that there is light at the end of the tunnel. We're seeing that. The vaccines are here. Currently, the The demand is still greater than the supply, but as that starts to even out, folks need to get vaccinated. I had a death in my family on March 30th. My 56-year-old stepsister passed away. She was in a local hospital since February 27th, was on the ventilator for 25 days, did not get better. The virus took hold of her lungs, and she passed away the day after her 56th birthday on March 30th. So as you mentioned, it's out there. It impacts people of different ages. Take it seriously, wear your masks, get vaccinated, and let's get through this so we can get back to a sense of normalcy. And I remember last year when the vaccination first hit, I had an opportunity to be on the Facebook Live with you and Representative Patty Kim. And we talked about all the unknowns at that time and what's occurred since then with the over 550,000 deaths across this great nation of ours. This pandemic has impacted every single person, regardless of age, regardless of socioeconomic status, regardless of race. It's here. It's probably going to be here in different forms for a while, but we have to work together to get through this.
Yeah, and you mentioned that demand is still currently exceeding supply, although I'm encouraged to hear from UPMC that it's only about a 5-day turnaround right now is what they're experiencing from call time to appointment. But what's the county's role, and what has the county been doing to help meet the demand? And can you talk a little bit about how these vaccines are making their way here into Harrisburg and Dauphin County?
Again, the supply has not kept up with the demand to date, but we're going to get there with the new Johnson & Johnson vaccines being distributed, as well as Moderna and Pfizer. Since the vaccines became available, the issue has always been supply versus demand, and that created challenges for everyone, everywhere at the exact same time. And we were frustrated just like everyone else was. We've been aggressively seeking a partnership with an enrolled vaccine provider, an entity eligible to receive the vaccine doses allocated by the Commonwealth. And we were fortunate to find that partner in UPMC. We had been planning since September of 2020 for a drive-through clinic, and HAC had agreed to be the host site. And we wanted to make sure we did not put the cart before the horse. We were not going to open until we had that commitment of doses. And once everything was in place, we built the clinic on HAC's West Lot in 72 hours time. We started delivering the vaccines on March 23rd, and we're averaging more than 900 doses delivered daily so far. And we've been increasing that number each day. Currently, we operate on Tuesday and Wednesday each week, but beginning the week of April 19th, UPMC has advised us that we'll be able to open 4 days per week. That's 2 days a week for the first doses and 2 days a week for that second dose distribution for people who received it at our site prior to that. HAC, it's right here. It's centrally located, easy ingress and egress to Route 81, 83, 322, the northern end of the county, the southern end of the county, Susquehanna Township, Lower Paxton Township, and the city of Harrisburg, home of our state capital. So it's only moments away, pretty much from anywhere in Dauphin County. Great central location. Thank you to Dr. Ski and the administration at HAC for stepping up. I also want to thank the Department of Public Safety, Chris Fisher, Lexi Passero, Andy McGonnell, under the direction of Director Steve Liphart, and also other folks and organizations that have stepped up to help us run that rather efficiently. The Medical Reserve Corps, the American Red Cross, and last but certainly not least, Chief Enterline and his great team at Harrisburg City Fire have stepped up to the plate, providing staffing and resources to enable this to run rather seamlessly.
Yeah, the vaccine clinic at HAC is truly a success, and we'll talk to the chief in just a minute and get his perspective on the ground there. And I'm encouraged to hear you say that we're going to increase the days of operation. We're going to double them, basically, especially as people come back for their second shots. That won't take away from the capacity we have to administer first shots, and we're going to be able to keep doing the hundreds and thousands of vaccinations that we need to do. let's talk for a minute, because we haven't talked about it, about testing. And testing is still important. We're very focused on the vaccine. But what are we doing? What's Dauphin County doing to help with the issue of testing?
For nearly a year now, Mayor, testing for COVID-19 has been an important part of the process and containment of this deadly virus. There's numerous locations offering testing throughout Dauphin County, pharmacies, urgent care facilities, and additionally, we partnered months ago in Hershey and hosted a drive-through testing center at the Giant Center. And hundreds of people on a daily basis were going through there and getting tested. And we currently have a partnership with the city and Harristown providing a testing site in Strawberry Square. And that runs actually this week through April 10th. So folks, if you can get tested, get out there and get tested. If you can get the vaccines, which you can now, go to UPMC's site, go to Penn State Hershey's site, contact your local pharmacy, take advantage of the opportunity to get vaccinated.
That's right. And you mentioned the downtown Harristown Strawberry Square testing site. That's important to get that word out. And we started the show with information that basically an estimate of about 130 new cases a day for the Harrisburg region, which is a lot. And you can't actually get vaccinated if you have COVID. So there's got to be this combination of vaccination and testing and everything else. I heard from an employer in Dauphin County just yesterday that they had made arrangements to get their team, make the vaccine available to their team of several hundred employers through arrangement. And I think we're going to see more and more of that, which is good news. Can you talk a little bit about how we're reaching out to some of our more vulnerable population and maybe seniors and others that probably aren't watching Facebook Live today, but maybe somebody who's watching will help share the word with them. But what's been our outreach plan for all this?
As you mentioned, some of our most vulnerable residents are our seniors and our underserved communities. The local healthcare providers are doing a really good job of not just what's been published out there publicly, but they're going into these local sites and providing pop-up clinics and helping several hundred people a day when they do that. And that really hasn't gotten a lot of media attention. So thank you to those healthcare providers that are doing it without that type of attention. They're doing it because they care, and they're doing it because they know there are certain segments within our population that don't have the ability or the wherewithal to go on a website or make that phone call, but the need is still there. The need is still great. Our area agency on aging has been taking a lot of calls, dozens of calls a week. And we understand that some of our older residents are not tech savvy and they're not able to navigate online. So when appointments and where appointments and information can be conveniently accessed, our AAA staff has also been keeping a list of individuals, compiling a list who wish to be vaccinated, but they're still having trouble getting an appointment. And our area agency on aging has been aligning those callers with the resources and vaccination registries that are out there. Additionally, the county has partnered for 2 mini vaccination clinics for seniors. One's on April 8th and one's on April 13th. And names from that list will be contacted and scheduled for appointments. So we're aware that the need is out there. The need is great. Again, I'm going to say it again. Light at the end of the tunnel is a great way to start this segment. And that's where we're at. There's light at the end of the tunnel, but folks have to take advantage of this opportunity to get vaccinated.
Yeah, and I think the mini clinics have been effective. We've seen them with the Housing Authority, Heinz Medical. We've seen them in places in the city which have worked very well. I think that's going to continue. I mentioned the type of mini clinics that employers are going to have and be able to offer, which is, I think, going to allow more workplaces to open back up. And there's really a compounding effect of all this. So a final question then. Let's end on the same note that we discussed with UPMC. From your perspective, Commissioner, make your case to people that are watching why they should step up and get vaccinated.
County commissioners, one of our top priorities is public safety. The coronavirus has become a safety issue, a health issue like we have not seen in our lifetime. Hopefully we never see again, but it's here, it's right now. So any opportunity that you can to get vaccinated or wear a mask when you're out in public, until we get past this, there are certain sacrifices that we have made. We need to continue to make, not just for yourself, but for those around you, not just for your family, but for neighbors in your community. And if you have an opportunity to get vaccinated, take advantage of that opportunity. The governor has stated that after April 19th, everybody's open to get vaccinated. The supplies are coming in. They're going to continue to come in. And currently, it's like this, where the demand is greater, but slowly but surely, we're going to have that even out and have an opportunity to reach that herd immunity number of 80% vaccinated. And that's going to help us get through this pandemic and get back to a sense of normalcy, which every single one of us, not just in the city of Harrisburg or the county of Dauphin or the state of Pennsylvania, everybody across this great nation of ours wants to reach that point again.
Thank you. Well, that's well said. And again, I'll encourage people to call the number or make the appointment. There was reference at the beginning of the show, because you can get an appointment now to get your vaccine, and the sooner you can get it, the better for all of us. So, thank you, Commissioner. We're going to turn now to our fire chief, Brian Enderlein, who can talk a little bit about the clinic. We've had it referenced a few times now in the show, but let's talk about the Bureau of Fire. How did the Bureau of Fire get involved, and what role are you all playing in making sure that this clinic is successful?
Sure. Good afternoon, Mayor. Good afternoon, everyone. We as a fire department, we take emergencies seriously. We do that. That's our daily job. And since the pandemic started last year, we've been heavily engaged with our partners at Dauphin County Department of Public Safety, both traversing those early uncertain times that we had. But as you fast forward, we knew that a vaccine was going to come out. The Department of Public Safety at the county did an amazing job of setting the clinic up. And of course, they needed some partners. And you know, fortunately for us, we have a great staff here in the fire department. And again, we know how to run things. It's our job to make something work out of a chaotic situation and make everything seamless. And fortunately, we've been able to do that. Deputy Chief Souter's been at the clinic nearly every day, and we've been staffing with 6 personnel on a daily basis. We're going to be bumping that to 8. I think the interesting thing is, you know, and I've said this before, and I'll continue to say it, if you need something done, you call the fire department and we will make it happen. I believe that our partners at UPMC have learned that we can teach them a thing or two as much as they can teach us. And so by adding additional staff up there, we're going to make the clinic even more seamless and fast for the public coming in.
Well, you guys are masters of logistics. I've seen it firsthand in all that you do, and you deserve a great deal of credit for that. But let's talk about what it's like from the perspective of somebody arriving at HAC to get vaccinated. Walk us through the whole process. You turn in. What do you see? How long does it take? How long will you have to be there? Walk us through.
Sure. The early morning, our guys start about 7:30 in the morning to get things set up. So a lot of behind the scenes work. When you pull in as a patient, you'll be greeted at a tent and given an opportunity to understand how to traverse all the cones. There's a lot of cones you see from the photo behind me. You'll go into a staging line. Once you hit that staging line, the directors will start to push you to the tent. So they'll run anywhere from 1 to 6 lines through the tent of cars, depending on the number of folks signed up for that particular time. Once you get up to that tent, you'll be greeted by a member of the Medical Reserve Corps, somebody from UPMC, or a Harrisburg Bureau of Fire member, and they will get your information from you. So they will take your license and verify that you have an appointment, and they will also ask for your date of birth to make sure that you're over 16. And there's one of our smiling firefighters. He's smiling, believe me. You just can't see it because of the mask. Assisting at the clinic. So they enter that data into the computer system. as they're doing that, they write a time on your windshield, as Lou had talked about, so that we can monitor you for 15 minutes after receiving that vaccine. They go through get into the tent. The medical professional that's able to administer the vaccine administers it. They're then given their card back, so you get your vaccine card, and it already has your next appointment scheduled for it. So the beauty of this is when you leave there, you know when you need to come back. So once you leave that tent, you're directed over to a staging area, and then that's where our great partners at UPMC, Community Life Team, EMS, and other Harrisburg firefighters are there to monitor. And we've had some issues. Some folks get a little concerned about receiving the vaccine, so sometimes they need to be talked to about it. Just reassuring them that they're fine. And monitor their vital signs and things like that if needed. And then once they're through that 15-minute window, they're dismissed and waiting for them to come back for that second round.
Do you ever leave your car in the process? Obviously, you pull over at the end for the 15 minutes, but
no. So you stay in your car the entire time. It is really roadside. It's like going to the drive-through fast food restaurant. Only you're getting the COVID vaccine to protect you and your family.
Great, that's amazing. And are we ready to ramp it up? We heard that we're going to double the number of days here shortly, and presumably as the vaccine becomes even more available, the supply, we might be able to increase the hours. How does it work from a logistics standpoint, since you're handling all the traffic control?
So from a logistics standpoint, there is a plan to increase the tent size. So that we'll be able to double the capacity. I believe that the true holdout at this point and it 100% is, Lou alluded to it, is the availability of vaccine. When we have that vaccine there, I have all the faith in the world in the members from the Department of Public Safety at Dauphin County, from UPMC, from our members, and our other partners, that we can any vaccine that they give us, we can get in arms in this clinic. There is no doubt in my mind. They have made an efficient, well-oiled machine to get you in and out. The wait times early on were, it was, I've heard 45 minutes to an hour and a half, and that was the first couple of days. Once that thing started rolling, though, you are in and out of there because of the efficiency. So all we need is more vaccines to get in the arms, and we'll be able to do it.
That's great, and they are getting in arms based on the numbers and the data. You're making a difference. Talk a little bit about why this is important to the mission of the Harrisburg Bureau of Fire. It's not. I know you're involved in emergency management and all the time, but this is something a little different and a little new. How's it been embraced by the members of the bureau, and why is it important to what you do?
So, we've been entrenched in this again since the start of it, and we are disaster managers. So when you look at it, this is an emergency. We have emergency declarations not only in the city, the county, the state, but the nation is under emergency declaration, and that's where we work best. And so our folks have been dealing with this as well as, again, UPMC Life Team EMS daily with in the streets. So those that caught that, we're the first responders that are dealing with and assisting those patients that are going to the hospital that are, and a lot of times, in pretty bad condition. So it was very important for us to be able to get those vaccines in the arms of our firefighters. At this point, we have just over 50% of our firefighters are vaccinated. And that really, again, is thanks to UPMC. They were very quick to partner with us to get those shots in the arms of our first responders, starting back late December, as a matter of fact. And it's been a great partnership ever since. And, obviously, we have some hesitation in our ranks. There's always going to be hesitation with a vaccine. I understand that. And those that wanted it have been able to get it, and we're going to continue that.
Yep, and we're seeing that I think some of that hesitancy decrease as time goes on, and more people get vaccinated without any serious side effects. And thanks for the view from the ground. We appreciate that, Chief. And if you're watching at home, I want you to consider putting your questions in the comments field there on Facebook Live related to vaccine distribution, whatever you have for our guests. And I'm going to ask our guests to stick around for just for 10 more minutes. But we are going to do. You want to do the questions before the recorded segment?
Yes, if we can.
All right.
I think
All right.
we
We're going to have a
here.
recorded segment then that we'll do at the end, but we'll do questions now because they're already coming in. All right, Momin, to you.
Yes, thank you, Mayor. First few questions here. We'll toss it over to Lou. First question here, it's about the vaccine lasting about 6 months. Can you shed some light on this? Is that the case, or is it too early to tell?
So what we have heard from those that are much smarter than me is that we anticipate that the vaccine has a 1 year existence for us, right? So it'll hold us for 1 year. The 6 months is relatively newer statement that has come out. And so I think it's still early. I think we still have some science to support what this will really look like and whether this will look like an ongoing booster similar to flu that we do every year. And so I think there's still more to come for that.
Okay. Great. Next question. I think these next two questions you may have touched on, but if you can reiterate, as far as the clinic, how many folks have you fully vaccinated and how many are partially vaccinated through that clinic?
So we are 60,000 total vaccines given, and not all at this clinic, but just for this region. And I want to say we are about 6,000 first doses through this clinic. And I don't actually recall the number of second doses just yet. I don't know if the chief has an answer for that one.
Okay. Okay. So, and Chief, if you wanted to add any comments, feel free to.
Actually start next week. So everything's, because we have the 1 month, we've been operating 3 weeks now. So next week starts the second doses. And the number that we had from our sit rep is about 6,700 have been through the hack parking lot so far.
Okay, great. Next question, back to Lou, is how many folks do you believe that you'll be able to serve daily through that clinic moving forward?
So our lofty goal is 2,000 a day. But we know we're not there yet, and we have some work to do to get there. And as the chief said earlier, there's opportunity for us to expand this clinic and working with their great partnership. We hope to achieve that 2,000 a day goal.
Okay, great. Thank you very much. Next question is for Commissioner Prees, and this may be a bit too early to tell, but if you can shed any light on this regarding vaccine passports. We've heard reports of that people may have to show a vaccine passport or certification when entering a business or other public place in the future. Have you heard these concerns at the county level, and can you shed any light on that?
The only concerns that I've heard or information I've seen on this is what I've seen in the media. I haven't been reached out to by any resident to date. From a county government standpoint or policy standpoint, this isn't something that we delve into. So I really don't have any specific information to answer that question.
All right, great. And that's the last question that we have for now, but I do want to remind our viewers, vaccine.upmc.com is where you can register, and there's a phone number on that website as well. Mm-hmm. Yes.
Yes.
I just want to give, again, a special shout out to the folks at UPMC, Pinnacle, and the folks at Harrisburg Area Community College, and to Chief Enterline and his staff. Our first responders, they are there on our behalf 24/7, 365. When that alarm goes off and we're at home or we're at an event like this, we're still at home at an event like this, but our first responders are responding in a moment's notice to help our residents when they're in their time of greatest need. They're always there for us. They deserve our support, and they deserve our special thank you. Chief, please say thank you to not just your staff, but your colleagues across this region. Appreciate it.
Yeah, thank you, Commissioner, for those sentiments, which I certainly echo. And I also think this is a great example of cooperation and how the city, the county, healthcare providers, first responders can all work to improve public safety and help the public. So with those questions, we are going to call it a day. I'm going to have a pre-recorded session now, but we'll sign off here before the session. And this is a recording of a conversation I had earlier in the week with a Harrisburg resident about our campaign to stop Asian hate here at home. This is an issue which has received significant national attention, but it's one that we wanted to drill down a little bit about in Harrisburg and how it's affecting some of our residents here. So we're gonna go out with that moment, and I'm gonna sign off now to all of our viewers and let our guests go and say thank you for watching. We will be back again next week, live Fridays at noon on Community Conversations. And until then, stay safe, be well, and enjoy this next pre-recorded segment. All right, everyone, we're now joined by Zach Huen, who is a certified planning technician at Harrisburg Hospital and a city resident, to talk a little bit about the Stop Asian Hate movement and its relevance here in Harrisburg. If you've been entering the city lately, you will notice that we've had up on the message board as you enter the city of Harrisburg, the message Stop Asian Hate, which is basically broader than just Asian Americans, but also includes the Pacific Islander communities. And we've been referencing a website with a lot of good information on it called stopaapihate.org. And we'll put that up as a link for people to potentially click on and get more information. But Zach, I wanted to get your perspective on this from the perspective of a city resident, somebody who works in the city of Harrisburg and somebody who is Asian American. Why is it important that we stand together and we condemn the Asian hate that we're seeing throughout the country?
Sure. So it's important because as an Asian American, we are minority to the African American and whites. And so we, as a smaller minority, we may be overlooked many times, but everyone deserves the right of equality, the right to live safely and not fear for their own life. Especially now through COVID, we all need to stand together in unity and to be there for one another. And being rude or discriminative against any minority or any group at all just breaks that unity.
Yeah, I certainly agree with that. And here you are on the front lines of fighting against COVID, and yet you look nationally and you see the headlines. And how does it make you feel when you see these actions that are taking place? Not so much in Harrisburg, but around the country.
Yeah, so it deeply hurts me just because it is my culture and my background that is being attacked. Even though I may not know the people who were related, who were victims, it still takes a personal touch to me, just because I know what it's like to grow up as an Asian American and to be discriminated and to be treated differently. And now that it's taking lives of them, it hurts me deeply and it almost scares me.
Sure, and we want everyone to feel support. Certainly, no Harrisburg resident to feel scared. Do you have a message to people that are watching this on Facebook right now that want to reach out, want to condemn this type of hatred and behavior, and want to be supportive? What can folks do?
Sure. So the simplest thing you can do is don't participate in the discrimination. If you see discrimination against anyone, just put a stop to it right there and then. Because if it keeps going, then people are going to start to think that it's normal, that it's okay, and that there won't be any consequences. But the consequence is really our future, because our future with discrimination is just not a very bright one for us, especially when we need to be standing in unity.
Yeah, and in Harrisburg, we have a strong and growing Asian American community. We see it in all parts of the city. Can you talk a little bit about your experience as a Harrisburg resident? Have you felt the effects of racism, subtle or otherwise, in your life and in your career path?
Sure. Yeah. So growing up as a Asian American, a lot of times kids don't, as I was younger, kids don't really understand racial differences. So they would make fun of mostly physical features, at least for myself. And as I grew up throughout high school, I was able to kind of just shrug it off my shoulders. Then I started working in a retail store in the pharmacy. And there are times where customers have refused for me to service them because of my background. And it's it's something, it doesn't affect me too much as of right now because it is what it is. You know, I can't change the way they view people. Um, but growing up, I was able to deal with it. But what is scary now is that the people being targeted really is our elders, the older people, the older Asian Americans, and they can't help themselves. They're defenseless, mostly because they're physically incapable of defending themselves. And I have my mom lives with me, and she goes on a daily walk. And she's been with me for about 6 months now, and she's gone on those walks even in the cold. And she didn't fear for her safety at all until recently, about 2 weeks ago. She asked me, "Is it safe to walk around the neighborhood?" And I asked her, "What do you mean by that?" Because it kind of came out of the blue. And she told me, "Is it safe because of everything that's going on? Will I get attacked? Will I get hurt?" And truthfully, I told her, I believe that the neighborhood I am in, that we live in, is safe. And I believe that the city is doing a lot of things to make sure that we feel safe with having police officers patrol the neighborhood and etc. And I told my mom that, but I know deep down she is still scared just because of everything that's going on. And that's kind of what prompted me to kind of take initiative and uh, contact you to see what we can do and see how we can raise awareness for this.
Yeah, thank you, Zach, for taking the initiative, for sharing your story, for prompting us to help get the word out. Hashtag Stop Asian Hate. Again, I want to refer people to the website stopaapihate.org for additional valuable information. We need to stand together in unity here in Harrisburg. And thanks for sharing your story. And I hope people will think about it next time we're all on our walks along the riverfront and we see somebody. Maybe take a moment to say hello and to spread some love and appreciation for others, and recognize that they may be fearful as they read the headlines and see the stories of what's happening outside of Harrisburg. So thanks again, Zach, and we'll go back now live.